Well, we're here with Dr. Pittaway from Kalispell in Montana. Hi, Dr. Pittaway.
Heidi Helmut, how are you today?
Good. Dr. Pittaway, let's talk about teeth, because you obviously are a dentist. Is that a good topic for you?
I could talk all day about teeth, Helmut.
Okay. Tell me, if a person has a choice, or, must make a choice, so to say, of all his teeth are missing, more or less, so they have to be all pulled because, he deteriorated them for whatever reason. We know that doesn't have to happen, but again, let's just say so it reached that point for whatever reason, and he has to make a choice of dentures or implants, or, as far as I know, lately with implants, there's almost like a hybrid out there where, you can do a few implants and put a denture on it, which is a little better than the old type of way denture. Can you shed some light on all three of the things on it? Because obviously there's a price difference, and price, with no doubt, does then play a role. And at the same time, how handicapping is a denture, if it is at all? What should we be aware of with all three treatments? Give us a good picture.
Well, Helmut, I have lots of information on that, but I'll try to be clear. Having no teeth can be a great handicap, not just physically, but emotionally. People without teeth, they don't want to go outside. They don't want to mix with other people. They can't function. They can't eat in public. It's a big problem. It's a disability, really. And so restoring teeth is a wonderful thing that we can do for people who have lost their teeth. And obviously implants are a great service now, because instead of having plastic prosthetic teeth that can slip and slide or come loose or are hard to chew with, we can rebuild prosthetic teeth that are attached directly to the jaw, or at least supported directly by something attached right to the jawbone, and it's a tremendous improvement in traditional denture. In fact, with anyone who needs a lower denture, I always recommend at least a couple implants for support, because it makes a world of difference in the quality of life.
Okay.
I could go on
Tell me something. Hang on a little bit. Tell me something. So, if a person has the dentures in it, so what you say is that he should be putting, especially in the lower one seems to having more problems fitting than the upper one. Is that what you're saying?
Oh, absolutely. The lower jaw doesn't support a denture very well. The upper jaw has, a good suction cup effect.
So, but basically a couple of 2, 3, or 4 sockets, 2, 3, 4 of those titanium metal sticks into the bone, which then the denture clips on it, is much better than the old time denture, which right away went, as a plastic, kind of like almost like a mouth guard over the thing. That's what you're saying.
Oh yeah, absolutely. The nice thing about that is the denture won't move when they're chewing. It won't come out when they're eating or laughing or sneezing. And it's just a world of difference. It's much more comfortable, and it protects the jawbone as well from breakdown. The forces of the denture rubbing on that thin lower jawbone tend to break it down rapidly, and the implants will support that denture and protect the bone from the rapid breakdown quite a bit. It's one of the greatest things that we can do for people now.
Right, because the bone breaks down. Basically the bone gets smaller and smaller. If you ever broken your leg or your hand and you were in a cast for a while, I mean, that arm and that leg became weak and small and thin right? So
well, that's true. It's not quite the same though. But the constant pressure on that bone does cause it to break down, and once you've lost the teeth, that's why the bone are there. And so once you start losing more of that bone, you can really end up handicapped. I have seen some older patients with really no bone whatsoever to place a denture, and they've been able to put a couple implants in there and just really change their lives. They're able to eat better. It's better for their health. It's a great technology that we have now.
Okay. If a person would have, let's just say, if money wouldn't be a major objective and a person needs all the teeth, obviously he would get a whole round of implants, wouldn't he?
Yes, there's a couple of ways you can approach that. If you want to replace every tooth with an implant, in some cases that works well. That might be a little more than you need because the implants can support a prosthesis. It doesn't have to be every single tooth.
Okay.
In some cases, we can make a prosthesis that attaches to a solid framework that's attached to the implants. That allows us to add more to the prosthesis to support the lips, for example, to make the facial profile look correct. Because if you lost bone and you place implants and just attach teeth, sometimes you're not replacing some of the lost bone and it doesn't look right. So this hybrid type prosthesis or denture, it's solid as a rock. It feels like real teeth. It doesn't move, and you can lock it in place, but at the same time, you look like you're supposed to. You don't have your lips collapse because there's not enough support hidden underneath them.
Right. Now, the lip collapsing thing and the cheek collapsing and, basically that comes from bone loss, right? Your arch is shrinking basically because it lost the roots of the original teeth which keep the bone intact, the jaw bones, right?
Yes, absolutely. The bone changes as soon as you start removing the teeth and continues to shrink and deteriorate over time. So, as soon as you remove the teeth, that supports your lips and face as well. And then you lose 40 to 60% of the width of the bone in your jaw as well. So you don't want to have some collapsed face looking like the old Halloween witch, for example, where her chin is just about touching her nose and pointing out that she has lost all of her support in her mouth and is pretty much doomed to soup and milkshakes.
Right. You'll start looking like a dried-out tomato or like a witch, as you said. Now, so that brings me nevertheless to an important point. So a person faced between a bunch of implants at least, maybe with some prosthesis, with some denture, versus no implants and only denture, his bones will keep shrinking if he doesn't put some implants in it. Am I right?
Well, it depends quite a bit on the individual. There are some cases where people can wear dentures long term and their bone is fairly stable, but especially with the lowers, it tends to break down and become a big problem after a while. And so the implants, or an implant-supported prosthetic teeth or fake teeth will eliminate the problem almost.
Good. So basically, putting in some implants at least, as many as possible, while not necessarily every tooth, and the dentist will decide that, seems to be also a cosmetic protection. You don't need Botox and cosmetic surgery after a few years because you had that, because you're keeping full, you're keeping natural.
Yeah. Well, the benefits are cosmetic, they're emotional, psychological, and physical. If you're chewing your food properly, that's the first step of digestion, right there in your mouth with the saliva mixing up. And if you're swallowing your food in big hunks or can't eat certain foods, it definitely can have a bad impact on your overall health. And so I just think it's great to be a whole person, have all the teeth, be able to do everything you want to. And, it's a wonderful service, and I really enjoy being able to let people get back to normal and have teeth and eat normal and be healthier, and just that's one of my favorite things to do.
Wonderful. Thanks a lot, Dr. Pittaway.